The Medical Condition Project by Grimmeison. Chapter 5. Obstructive Sleep Apnea. During sleep, the absence of activity of the pharyngeal muscle allows the airway to close. It is often associated with an increased risk for cardiovascular disease, diabetes, and a stroke. Obstructive sleep apnea is commonly found in obese people, and it can be diagnosed with a polysomnograph, which is a sleep study. Some of the treatments for obstructive sleep apnea are weight loss, a uvulopalatal-pharyngoplasty, which is a surgical procedure to remove excess tissue of the throat, and a continuous positive airway pressure, or CPAP, which is a machine that delivers constant airflow through a tube or mask seen in the picture above, and it creates pressure so your airway is held open during sleep. Some of the specialists that would help treat and diagnose obstructive sleep apnea are sleep specialists, and they would perform the polysomnograph that would help diagnose it, and an otolaryngologist, which is an ears, nose, and throat doctor. They would help to treat the obstructive sleep apnea. Chapter 6. Chronic kidney disease. Chronic kidney disease is an irreversible disease that progresses to get worse and worse. It causes the loss of renal function and causes uremia to form. Many things may cause this, like hypertension and high blood pressure. The treatment for chronic kidney disease is to get a kidney transplant. While you are waiting for a kidney transplant, you may be put on dialysis. Dialysis is where you're hooked up to a machine that purifies and filters your blood. Each treatment can last up to 4 hours and are done 3 times a week. A kidney transplant is where you get a new kidney from a donor to replace your bad kidney. The specialist associated with chronic kidney disease is a nephrologist. They are a kidney specialist and will help diagnose and treat kidney diseases. Chapter 7. Prostate cancer. Prostate cancer is cancer of the prostate gland. It is the most commonly diagnosed cancer in men. How it is diagnosed is either by a digital rectal examination or a transrectal ultrasound. A bilateral orchiectomy is a surgical procedure to remove the testicles. Removing the testicles may overall reduce the amount of testosterone in the body. With the reduced amount of testosterone, it may help to stop the growth of the prostate cancer. Chemotherapy is where they use drugs to help destroy the cancer cells. There are many ways to treat prostate cancer. One of the ways is with the radical prostatectomy. A radical prostatectomy is an operation to remove the prostate gland and the tissue surrounding it. This may include the removal of the seminal vesicles and some lymph nodes. A radical prostatectomy is used in those in men whose cancer is only in the prostate gland. Another way to treat prostate cancer is with radiation therapy. Radiation therapy uses high-energy rays to kill the cancer cells. A specialty associated with prostate cancer is a urologist. A urologist is a doctor who specializes in the urinary tract and male reproductive system. Chapter 8. Toxic shock syndrome. Toxic shock syndrome is a condition where an overgrowth of Staphylococcus aureus and Streptococcus pyogenes release a toxin into the body. Toxic shock syndrome is most often associated with women who use extra absorbent tampons. Some of the symptoms of toxic shock syndrome are having a high fever, a rash, vomiting, diarrhea, or myalgia. It is possible that you could die from having toxic shock syndrome. One treatment is to use antibiotics in order to help fight the bacterial infection. Because toxic shock syndrome is pretty rare to get, there aren't really any specialties that would help diagnose it. If you have these symptoms, you might go to the ER where an ER doctor will diagnose you. Or you might go to your general practice doctor and they might diagnose you. Chapter 10. Abdominal aortic aneurysm. An abdominal aortic aneurysm occurs in the aorta, or more specifically, the abdominal area of the aorta. They are often caused by trauma or high blood pressure. An abdominal aortic aneurysm can be diagnosed in a number of ways. One way is through a normal physical exam. Another way is with a computerized tomograph or a CT scan. And another way is with an abdominal ultrasound. One way you can treat an abdominal aortic aneurysm is with an endovascular stenting. Endovascular stenting is where they insert the stent into the femoral artery via a hole, and then they guide the stent to the portion that has the aneurysm. The stent is used in order to make a new passage for the blood to flow. Surgery is often done on large abdominal aortic aneurysms due to the fact that once they have ruptured, they have a very low success rate in surgery. Smaller ones are watched closely. Some of the specialties involved with an abdominal aortic aneurysm are a cardiologist, a doctor who specializes in the heart, and a cardiac surgeon, a surgeon who specializes in heart surgery. These are the references I used for the information I got.